Welcome to the module, Accessing VA Healthcare. This was produced by CalTAP and presented by Swords to Plowshares. Now let's get started. When we talk about VA healthcare, a question comes up of why should you enroll in VA healthcare? And there's a few reasons for that. It's a veteran-specific medical focus. Since the VA healthcare system is a centralized healthcare system focusing on veterans, we expect a higher degree of cultural competency when it comes to veterans. We expect a better understanding of medical conditions when it comes to veterans. For example, even though PTSD is a universal thing, a lot of people can get it for a lot of different reasons. When you have healthcare that's centered on veteran specific, that's a fundamentally different understanding of PTSD rather than a civilian component who might not be familiar with PTSD related to time in service. Same thing comes to physical issues. There might be certain physical health issues that make more sense in a military environment that civilians may not be as aware of or have that competency. They also conduct research and insights into emerging veteran issues. When we think of things such as PTSD and we think of traumatic brain injuries and a whole host of other issues, is that there's a lot more stuff that is veteran specific and how it's formed is unique to veterans, and they conduct research that's related to it. By conducting that, we're better able to develop a level of healthcare that can appropriately treat our issues. You also may have been exposed to different chemical, physical, environmental hazards during service. A civilian doctor may not be flagged to search for these issues. And when we talk about healthcare, especially in the spectrum of the military, and we talk about as veterans, there's a ton of stuff that as veterans, we ourselves may not be aware of. So where you might think, oh, you have a seemingly normal health issue or a health issue that everyday civilians might have, but let's say you're having a health issue that might seem odd for your age or isn't something that you've noticed in your family, and you're kind of wondering, I don't know how this popped up, but I have it. A civilian doctor may completely miss that. Whereas within the VA, they might set off a warning where if they hear that and then it seems kind of out of place or it doesn't make sense, it's because it could be directly related to your time in service. That segues into that service-connected disabilities are more easily diagnosed and connected to benefits when you enroll in primary care. There are a lot of things where the line seems more drawn and they're able to directly correlate those issues. What's beneficial about that is, let's say you go to a civilian doctor or you're at a civilian hospital and you're having issues that are related to your time in service, and then you go to seek getting service connection. You'll have to go through additional paperwork in order to be able to transfer those medical records and draw those connections. But by going through the VA healthcare system, you have doctors who are already able to consolidate that information and directly connect that information in a better informed manner, in a way that has cultural competency connected to it. So when you do meet with counselors or you meet with people who are making these decisions, or let's say you're also trying to get voc rehab, they can immediately connect into the VA healthcare system and see that information on the spot rather than having to go through additional bureaucratic hoops to get that information from your civilian healthcare. How do I apply? You may apply for enrollment at any time. You can apply online, you can apply in person, you can apply by phone, or you can apply by mail. When it comes to getting an appointment, you may request a doctor's appointment at the time you apply. Once enrolled, an appointment will be made with the VA doctor or provider, and you will be notified via email of the appointment. If you need health care before your scheduled appointment, you may contact the enrollment coordinator, urgent care clinic, or the emergency room at your local VA medical center. When we talk about getting your healthcare benefits, let's go over the discharge requirements. So as we can see here, when it comes to VA medical and dental, you have to have an honorable or general discharge. For other than honorable, as well as the other forms of discharge, these are subject to other certain conditions, except in the terms of dishonorable discharge, of which you are not eligible for any of these benefits. When we talk about the GI Bill and Voc Rehab, for example, GI Bill is not eligible under general discharge. Voc Rehab is something general discharges can be eligible for. Now, under the Affordable Care Act, or ACA, subsidies at lower cost for households with incomes between 100 and 400% of the federal poverty level, or FPL. If you are currently enrolled in VA healthcare, you don't need to take additional steps to meet the healthcare law's coverage standards. The healthcare law does not change VA health benefits or veterans' out-of-pocket cost. While we're talking about ACA, it's important to note that Covered California is an easy-to-use insurance marketplace that implements the Patient Protection and Affordable Care Act in California. On to mental health. The Guide to VA Mental Health Services for Veterans and Families is intended for veterans, veteran family members, members of veteran service organizations, or members of other groups interested in VA mental health care. There are a multitude of mental health services available for veterans. Below is a few examples we have in regard for mental health services available, such as PTSD, substance abuse, military sexual trauma, special populations within the veteran population, military exposures, which is focused on a range of chemical, physical, and environmental hazards that you might have encountered during your time in service, and how that can both impact you and your mental health, and community care. A facet of this is vet centers. Now, vet centers provide counseling, outreach, and referral services to veterans and their families. Often, the readjustment counselors are veterans and know what the veteran has experienced because of their military service. Counseling is offered throughout the country. What's important to highlight when we talk about vet centers is that these are more on the community, they're more community-centered. When you're engaging them, it's not like going to a hospital setting or a very strict clinical setting. We're talking about something that is very community-oriented. And so it exists in a way where it might feel like it might be outside of the VA, but really is a community focus of the VA and a major component of community care. We're going to go over eligibility, and we're going to talk about the call center. When we talk about eligibility for being able to use VA centers, we're just talking about having served on active military duty in any combat theater or area of hostility, or if you've experienced military sexual trauma, or provided direct emergent medical care and mortuary services while serving on active military duty to the casualties of war, or served as a member of an unmanned aerial vehicle crew that provided direct support to operations in a combat zone or area of hostility, or Vietnam era veterans who have accessed care at a vet center prior to January 1st, 2004. Now, as you've noticed, this isn't necessarily as reliant on others. It's a lot more accessible, and it's, again, more community-centered. This is a confidential call center that focuses on combat veterans as well as families, and they can talk about their military experience or any other issues that they're dealing with when it comes to readjusting and transitioning into civilian life. The staff itself is also very much still made up of combat veterans from multiple eras and their families as well. So it's basically combat veterans and their families helping combat veterans and their families. We're going to give a small overview of different issues when we talk about mental health, and we talk about different things that very much does relate to VA healthcare. So starting off, post-traumatic stress disorder, or PTSD, fortunately is pretty well known in general by now by the majority of people. The problem with that is that there's a lot of misinformation or a lack of understanding. PTSD is a disorder that can occur after you've experienced a traumatic event. PTSD can happen to anyone, and as a veteran experiencing combat, military sexual assault, or other forms of trauma during service increases your risk for having PTSD. When we talk about symptoms, it's important to keep in mind that You don't have to have all of these symptoms to be diagnosed with PTSD or to have PTSD. And all of these symptoms are on a spectrum. Not one person has the exact same symptoms that another person has when we're talking about PTSD. There might be commonalities, but specific to commonalities. Reliving the event. This also might be rethought of as flashbacks, but flashbacks aren't what we think of necessarily in the stereotypical sense of, oh, I'm tossing back to this particular scene, but rather re-experiencing very vivid memories. Avoiding places or things that remind you of the event. Shifting to more negative thoughts and feelings. And feeling numb. Feeling keyed up as well, or hyperarousal is also another one. Programs and services are available at the VA and may be accessible to you or your loved one when we talk about PTSD. Substance abuse. There are common risk factors of substance abuse and addiction which may affect you or your family. The VA provides specific programs and services for those that may suffer from substance abuse and addiction. Military sexual trauma. MST includes any non-consensual sexual activity. May have been pressured into sexual activities, may have been unable to consent to sexual activities, or may have been physically forced into sexual activities. And other experiences include unwanted sexual touching or grabbing, threatening, offensive remarks about a person's body or sexual activities, and or threatening or unwelcome sexual advances. How to find care. Veterans can receive free confidential treatment for mental and physical health conditions related to MST. That includes vet centers, again, as we had mentioned. You can receive this MST-related care even if you are not eligible for other VA services. You don't need a VA service-connected disability rating. You don't need to have reported the incident when it happened or to have other documentation that it occurred. Special populations in VA care. When we talk about special populations, we're talking about various demographics that might have different things specific to them. So when we talk about older veterans, we're talking about a range of older veterans, not just specifically Vietnam era veterans, but they are a huge component of that group. Women veterans, LGBTQ plus veterans, and homeless veterans. When we talk about military exposures, as a veteran, you may have been exposed to different chemical, physical, and environmental hazards during your military service. The VA has a lot of resources available. If you're concerned that you may have been exposed to any environmental hazards during your military service, it would benefit you to check them out and look into it. Think about all the different times you've been around chemicals that may have been affecting certain sensitivities, may have impacted your breathing at any one point. Think of burn pits, anytime you've been around particular fuels or just a constant source of chemicals that you may have not have been exposed to or exposed to in a long-term capacity within the civilian environment. Registry evaluation. So the VA's health registry evaluation is a free, voluntary medical assessment for veterans who may have been exposed to certain environmental hazards during military service. What do you need to know? If you're exposed to any chemical, physical, or environmental hazards during your military service, you should visit a VA environmental health clinic or contact a local environmental health coordinator if you're concerned about your health due to any potential exposure. Enroll in VA healthcare to improve your health and learn how to file a claim for military exposure-related disability compensation. Now, for the Mission Act, or Veteran Community Care Program and non-VA care, if enrolled in VA healthcare, the Community Care Program allows you to receive healthcare in your community when needed. This does not impact your existing VA benefits. You are eligible if your local VA medical center cannot schedule your appointment within 20 days for primary care, mental health care, and non-institutional extended care services, and 28 days for specialty care from the date of request within certain exceptions. Services are unavailable at your VA. You need to drive more than 30 minutes to your primary care, mental health, or non-institutional extended care services appointments. You need to drive more than 60 minutes to your specialty care appointments. Now, in determining cost. When we talk about determining costs, if required to contribute to the cost of your care, it is important to understand what you will be contributing and how this is determined. Sometimes our copays a veteran will have to contribute to care. Some veterans will qualify for free health care, and you may be required to complete a financial assessment or a means test. Important. There is no change in VA's policy to provide no-cost care to veterans who cannot afford to pay for their care, have catastrophic medical conditions, have a disability rating of 50% or higher, or conditions that are officially rated as service-connected. For OEF, OIF, and OND veterans, service members can receive enhanced VA healthcare benefits with 5 years of free VA healthcare post-military discharge. What does that mean? That means the moment you get your DD-214, you have 5 years from that point to receive VA healthcare specifically to you being out of the military. For information, you'll want to check out the documents that are related to this module. Specifically, Module 3. Hopefully that's been a nice, short, and informative presentation to give you at least a general overview about accessing VA healthcare. It would definitely be better for you to check out the documents that we directly have. Also regarding this, I can go into a lot more specifics and technical details. Thank you for your attendance and good luck on your journey.